So staff members are required each day before reporting to work to self-certify that they're free of any COVID-like symptoms. And if they do have COVID-like symptoms, they report that to their supervisor and to the Human Resources Office. And then they stay off campus. It's very important to us that staff members who are experiencing symptoms not report to work. And we've had strong compliance with this. Everyone's trying very hard to keep the students and everyone safe. So what happens is a staff member reports to their supervisor and to Human Resources that they have symptoms, and then we talk with them about what the next steps are. And those next steps include making sure that they're healthy. And there's a few ways that that happens. One way is the employee might have to stay off school grounds for 10 days or more. Another way is an employee can get a note from a doctor explaining this patient doesn't have COVID, this patient has some other condition. Another way is to get a result from a COVID test that indicates that the patient does not have COVID, and then as long as their symptoms have improved significantly and they're fever-free for 24 hours without the help of medicine, then they're allowed back on campus. And that way we can make sure that everyone who's coming on campus is safe to do so. So close contacts are defined by the Illinois Department of Public Health and the DuPage County Health Department as someone who was in close contact at a time when the patient is presumed to have been contagious. There's a lot of detail there, so what we do is we ask a lot of questions, identify from the person who might have COVID when they were last at school, when they developed symptoms, if they hadn't developed symptoms, when they took the test that led to a positive result. And then we talk about close contacts at work, and typically what that means is somebody who is closer than 6 feet for 15 minutes or more cumulative in any 24-hour block of time when the patient is presumed to have been contagious. But we're also concerned about a group that we would call lower risk contacts. So these are folks who weren't in close contact but had a higher level of exposure than somebody who wasn't in the vicinity. So these low-risk contacts are notified so that they can do a good job of paying even extra attention to their symptoms, monitoring themselves even closer, being even more aware of their own bodies and symptoms just in case they've contracted the disease. So we kind of walk through the day and we identify those staff members and those students with whom someone might have been in contact so that we can then notify those people in turn.